Well, happy holidays, Oklahoma Psychological Association. This is your Executive Director, Dana Fauble, coming to you with your renewal video and notice just to check in and just let you know a little bit about what OPA accomplished this year. Boy, we were busy on your behalf, and thank you for those of you that were engaged and involved. And thanks to those of you who came to our annual conference. We consider the Self-Care Conference a tremendous success. All of that attributed to Dr. Glenna Stemley-Bear-Riddle, who will be your president of OPA for next year. So as we reflect upon 2024, in hopes that it gives you just a little bit of glimpse of how busy we work for you, our member, I thought that I would just kind of list some things out. As you well know, we passed the reciprocity bill, and that was huge. We had a bill signing ceremony at the Capitol where the governor signed the bill, and we had Dr. James and a variety of different folks there. That was huge. The bill became effective November 1st, so we are looking to use that in partnership with other states around us, but it was initially written because Texas had already expressed an interest in reciprocity licensure for Oklahoma. So in addition to that, with the November conference, we hosted 7 continuing education events this past year. Several of them were related to managed care, and we helped you maneuver that process. And we hope that you found those successful, and we have a couple of events already scheduled for 2025. So take a look at OPA's website and register for those. Both of those are APA accredited by our partnerships with other states, so we hope that you will take advantage of that and join today. In addition to that, we did start a master's level clinician task force. If you've not filled out the survey yet, there's still time. The master's level task force is trying to involve and engage many of you in town halls coming up next year, in hopes that we can finally define what this looks like for our state, and whether or not there's legislation, or whether or not we will use the legislation and the statutory changes that APA and ASPBB put together to determine whether or not we want to be the leader in this discussion and be the leader in shaping how we use master's level clinicians under our license or not. We also expanded the OPA quarterly newsletter, as you well know, to weekly newsletters. And those weekly newsletters have stopped for the year just because we know that you're inundated in trying to get ready for the holidays. But we found that a lot of our responses to the newsletter and reading were not as great the last part of the fiscal year. So we have suspended those, and we will be doing one last quarterly newsletter for you in December. And that will have a list of all these accomplishments that I'm sharing with you today. So I won't give you all of the details, but we also started a forensic task force, and that forensic task force has sent letters to key leaders in the Healthcare Authority, the Department of Mental Health, with the governor's office, and also with Gettner Drummond's office, in trying to insert psychological testing, evaluations, and recovery programs into the jail systems. I know that the lawsuit has been settled, but we feel like that there is a void there that psychologists can certainly fill, and we will be working with institutions of higher learning to ensure that students that we put out into the field, whether they be master's level clinicians and or psychologists, are prepared to be able to work with us in expanding those services in those areas, those critical areas. We also hope that you enjoy the happy birthday emails. If you've had a birthday this year, you should have received an email from us just kind of engaging you, letting you know that we recognize that you're a member and that it was your birthday. And then I think I'm going to save the rest of that because you will see our legislative priorities for next year. We continue to expand upon those, but one of the things that we have in there is supervised billing. And you probably know this about postdoc billing. So Dr. James and myself have been actively involved in several different meetings with the Oklahoma Association of Health Plans, which is an association like ours, but it's for those that are working in the self-insured, the private insurance, commercial insurance realm. And as part of that conversation, we believe that we will be able to begin allowing postdocs and possibly interns be able to bill commercial insurance. And we can do that without any statutory language. Although you will see it still on our legislative agenda, and our lobby team is still making sure that we have legislators signed up to introduce a bill again. We believe that as late as the week before Thanksgiving or the week of Thanksgiving, that we receive some text messages that Blue Cross and Blue Shield are working very hard to try and help solve that for us to get access to mental health professionals quicker and be able to reimburse you at the commercial insurance rate for those. So that's extremely exciting. I hope that you find value in all of those things that I just mentioned in this video, so much that not only will you renew today, but more importantly, you will invite your colleagues who have not enjoyed the benefits of OPA and all that we try to do for you and for the practice of psychology and the profession of psychology, and elevating psychologists in everything that this state does related to mental health. We appreciate you. We thank you for your previous investments. We look forward to working with you next year. And I'm excited about the leadership under Dr. Glenna Stumbling-Bear-Riddle, but also the president-elect after that, Dr. Jadine Rogers. As you saw at our conference, or if you didn't see at the conference, we will be having press releases in our newsletter, but the press release will basically let you know that Dr. Rogers has been really advocating on fee-for-service, and she has done yeoman's work already behind the scenes, a lot that she has not gotten credit for yet, but we felt like that it was good to recognize her at our annual conference with an award for that. But she continues to elevate psychologists, wants us to be leaders, so we hope you're ready, because between the self-care that Dr. Stumbling-Bear-Riddle wants us to ensure each and every day, to the advocacy work that Dr. James has started for postdocs, interns, and also our workforce, to what Dr. Rogers is trying to do in making sure that psychologist is at the forefront of everybody's mind when it comes to mental health as the professional that you are. So thanks again for being an OPA member. Spread the word. Ask others to join. We are anxious to have them involved, because the more folks that are involved, the bigger our voice is. Happy holidays. Merry Christmas. See you soon.